This is Sport Youth Uganda, amplifying voices of young people. Voices of young people.
It is a great evening here in Kalangala district, specifically here on Bugala Island, where we are gathered for a Fire Chat Podcast that is powered by Sport Youth Uganda on this day of 26th June 2024. In today's topic of discussion, we are on to addressing contraceptive access barriers among adolescents as a means of mitigating teenage pregnancies in Kalangala district. And we're exploring the multisectoral approach. We look into the roles of different stakeholders in the district in challenging the persistent rates of teenage pregnancies in the district. I'm joined by the panel, including the Kalangala District Assistant District Health Officer, the Deputy RDC, a poverty youth advocate, a health worker, and a journalist. I am extremely excited to host such a panel of expertise, specifically on issues of teenage pregnancies. My name is David Sekainga, your host for today, poverty youth advocate, a local journalist corresponding to Daily Monitor and CBS FM in Kalangala District. Without wasting any time, let me allow my panelists here to introduce themselves, beginning with a journalist here.
I'm glad to join you on this podcast. My name is Samuel Onkuba. I'm a multimedia reporter under Vision Group corresponding to Bukede TV1, Urban TV, New Vision, Bukede paper and online platforms, together with our New Vision podcast.
Good evening, everyone. Namwanga Christine Kavusu, a health worker, working with Kalangala Health Center for and AHF Uganda Cares.
Good evening, everyone. I'm Dorothy Ziriwagwa, a youth counselor and a youth advocate, Power to Youth, Kalangala District.
Good evening, everybody. My name is Jen Namkasa. I'm the assistant to the district health officer in charge maternal child health services in Kalangala district.
Good evening, everyone. My name is Kajubi Twahika, assistant RDC Kalangala.
Thank you very much for the introduction, and I warmly welcome you once again to this Fireside Chat Podcast. Just to remind you of our topic is addressing contraceptive access barriers among adolescents as a means of mitigating the teenage pregnancies in Kalangala district. We are exploring the multisectoral approach, that perspective, and the podcast is powered by the Power to Youth Uganda. To start with, teenage pregnancy is a significant challenge in Uganda. And according to the Uganda Demographic Health Survey of 2016, the country has one of the highest adolescent birth rates in the world, with approximately 25% of girls aged between 15 and 19 years already began childbearing. In Kalangala district specifically, Kalangala district is one of the regions in Uganda with the high rates of teenage pregnancies. According to an article published by New Vision on September 18th, 2023, the teenage pregnancy rate stands at around 37%. Almost 50% of the teenage girls in the district are mothers, and 18% of adults have HIV. Both rates are 2 to 3 times higher than the rest of the country. I will begin with a journalist here that has been doing investigative stories on issues of teenage pregnancies in Kalangala district. So Samuel Nkuba is a journalist working for the New Vision in Kalangala district of Vision Group. Samuel, from your reporting, give us more highlights on the situation of teenage pregnancies basing on a journalistic view.
Okay, thank you so much. As I introduced myself, Samuel Nkuba, a Vision Group reporter in Kalangala district. Having spent some time reporting on different issues, basically on teenage pregnancies and the issues to deal with teenage mothers, I'll start with the real incident that has just happened of recent, where a 17-year-old girl on Bukasa Island was forced by his stepdad to move away from their house to go and at least get someone who can take care of her without her mother's consent. This is a girl who has been grappling with her education since her senior Happy 7 on Bukasa Island. And she's in a senior one now. But look at a scenario where this child or this girl is being chased away from home by his stepdad, that he cannot be with her mother and her also in the house. What were the end results? The girl ended up joining a lodge, and in end, he got a boy who is 18 years. These are real issues. Look at that scenario as I've brought it to you. Now, the girl is confused which step to take on. Should she look for another man? Because the one who she was with in the lodge was imprisoned. And now she's looking for anywhere else to stay. Why did I bring this? Teenage mothers, sometimes it isn't the will of these girls, but it is the force that comes from the community, leave alone the community alone, but also the parents themselves. What fuels this? It's because many of the teenage girls in Kalangala are not natives of these islands. These are girls who have been filled in or who came with their single parents to look for a living on the islands. And in coming to these islands, you find out that they end up either being used in bars or being used by their stepdads or other members of the community who say that on the island there isn't any young person. That if a girl just gets some breast on the chest, that's it, she's grown up. However much, either she's 12, she's 13, 14. Some men take it that this girl is ready for marriage, for whatever. And sometimes these parents don't take care because they need money. And if someone can be able to fill her needs like a parent through this girl, then there's no need of taking care of whether she's impregnated or not. These are real issues we find in communities. On Kachanga landing site, that is Bufumira sub-county, there is a mother who sends her child at a tender age of 15 to go and look for something to eat for the family. What do you think this girl is going to do? Give in her body and then look for something to eat for the family? At Kasekulo landing site, I interviewed 3 girls. All of them were brought in the islands, being promised to work in good places, hotels and what. They ended up being brought in at night, and in the real end, they ended up in bars. They were at a tender age of 14, 16, and 15. Ending up in the bars, they ended up getting pregnant, giving birth at a tender age. One is having 2 children now. Another one is 1, and another one is 1. So you look at these scenarios. Why teenage pregnancies? Oh, how do we come to teenage pregnancies? Looking at all these scenarios, they put a high risk on these teenage girls who live in landing sites. A high risk of going into sex work, setting up their bodies, going with men whom they are not willing to be with, but in search either for what to eat or for school fees, because some parents are not willing to pay for their children. Also, the setup of the islands. You see that we are in a refugee settlement system. When you go to those landing sites and their kind of settlement, this doesn't give a room for any privacy to girls and boys. Parents, they have a single room. It's the living room and it's the bedroom. Whatever is done at night is done when these girls are hearing or listening to. You look at a scenario where these girls are exposed to dayboard prostitution in some islands. They are exposed to different cinemas, which really are shown from morning to evening in the islands. So all these put a risk at girls, and they end up getting into some actions which they are not ready to. And then another thing is that some girls move long distances. What patterned this girl to go in with a boy of 18? He used to move from Lukuba landing site to Bukasa Secondary School, of which it's like something like 10 kilometers to the school. This girl ends up finding many men on the way who can interfere with her life, giving her some words and all of that kind of things. And then she ends up like giving up, saying, why do I suffer all day, all night, walking here and here? Let me just go in for this. So a lot of factors are fueling these teenage mothers or these teenage pregnancies, parents inclusive, on the islands, because they've abandoned their role as parents in nurturing the future youth or the future people. In nurturing, I mean, they don't take care of them. A parent working in a bar, what do you expect her to show her daughter or a son? They will end up also going in bars or using that girl to entice men come and drink, and it ends up in teenage pregnancies. So according to me, I can give a teenage pregnancy in that perspective. Some factors fueling it. Why do these girls go in? Basing on all those factors, they end up in that. Thank you.
Thank you so much, Samuel Nkuba, for that insight or point of view. As a journalist, we all know that Power to Youth is one of the programs that seek to support the district in addressing these sexual reproductive health challenges, amongst which is teenage pregnancies. And I'm glad to be joined by one of our youth advocates, Mrs. Dora Ziribagwa. Being a youth advocate, why do you think we still have a lot of issues around teenage pregnancies currently?
Thank you, the presenter. I would thank my colleague, Mr. Nkuba. He mentioned most of the issues. Since I stay on the island, one of the reasons as to why we are having these cases is child neglect by the fathers of these children, whereby the mothers are carrying the full responsibility, both looking for money and taking care of these children, of which one has to lead and the other has to lag behind. Child neglect by the fathers. They have failed to take their responsibilities as the fathers to help these mothers raise up these children, whereby you find a mother exposing her real daughter to these men who intend to have money so that they can collect some needs for home. I wish some bit of Luganda because I want this information to reach even that person who can't use English. Nti wekanga bamaama balina osindika abaana baabwe oba okubatega kye bayita okutega ennaku zino olulimi oluliko omwana wo obuwala asobole okufuna akasente basobole okulabirira ewaka. And secondly, what has brought this lack of access to health services for these adolescent children. For example, access to condoms, access to contraceptives. Since you may find that I stay in Lujawa and the health center is in Kachungwa, whereby it will take long for this adolescent to go or to transport to the Kachungwa to gain access to that service as an adolescent. The other reason is the services which may help them not to get the early pregnancies. They are not well informed as the young children, as the adolescents. They may find that you don't have youth counselors. In some areas they may be there, in some areas they are not there. So they lack information of the outcomes. Just in case Singanti, she finds herself in that state, what will she do? And the other point is that we found an issue in one of the islands, nga contraceptives bazibaguza mutwalo. Imagine, an adolescent, where can she get that money? 10,000 shillings to get, of which it would be free of charge. And I think in government hospitals it must be free of charge. But we may find that it's expensive to them and they can't access them. Another issue is that most children in the islands don't go to school. They intend to be working. They go for work at early ages. We found a case in Ebufumira. 11 years, child goes for fishing. He accesses money at an early age. So the value of school, tajirina. That's why Inti Yekanga has to involve in our young children who already go to school.
Thank you so much. It's a very good discussion and points that are coming in. showing on the issue of teenage pregnancies, ranging from teenagers not accessing contraceptive method. Let me first go back to this journalist. While you were doing your work, any character of fishermen that you saw that leads to these teenage pregnancies?
Thank you so much. Having a lot of money by these fishermen entice girls to go for them because they are in need. And being in need, she will automatically go to someone who seems to be having a lot than what she needs, or to someone whom she thinks can fulfill her needs. That is one. Another character is that these fishermen, as I said in the beginning, that they have that mentality that there isn't any young girl on the island. Whoever they see is old enough to do whatever they want to do. I will give a scenario also. There is a mentality of, I'm sorry to speak so, but we are youth, that these young girls are the one who can fix their manhood. This is based on an incident that is on our Lukuba landing site on Bukasa, where a man is alleged of using young girls more than one time, more than 2-3 girls, that these young girls are the ones who can fix my manhood, and when I go in for these old women, I can't feel that I'm doing anything. And this is a real story where these young girls are giving testimonies that it's happening on them. And so this tendency also has really done much in teenage pregnancies. A long time ago, we had this myth, and I think it's now fishermen are abandoning it, having got some idea or sensitization campaigns that wherever you sleep in with a virgin girl, when you go to the lake, you get high catches. It used to be that tendency. Sometime it was really a myth, and as per now, we see some trends changing, but not changing for good. If changes from virginity to say that these young girls are the ones who can fix my manhood, then where are we going? You see that these factors are fueling more.
Thank you so much. Yeah, you're still listening to Fireside Chat Podcast here in Kalangala District, powered by Party Youth Uganda. Just to remind you, our topic of discussion is addressing contraceptive access barriers among adolescents as a means to mitigate teenage pregnancies in Kalangala District, exploring the multisectoral approach. I'll bring in a health worker after listening to all these issues from journalists here, Samuel Nkuba, and a youth advocate. As a health worker, you have heard from the youth advocates and the journalists about the access challenges, some of which are directly attached to the health department, some of them are attached to challenges in service delivery of these contraceptives. Others, the distance of getting these distance between where they live and where the contraceptives are. Do you have what do you have to say in response to some of the highlighted challenges that are directed to the department?
Thank you once again, Mr. Presenter. I've had challenges that really the youth of Kalangala district face in accessibility of contraceptives and other reproductive health care services, as uttered out by the youth advocate. And I'll start by addressing the issue of lack of information. She talked about lack of information. We still have a challenge of disseminating information and correct information to the youth and the population at large. However, as health workers, we've tried to educate or sensitize through through medical camps, through visiting the schools around, through radio programs that the journalists normally call us to go and address. We've really tried to educate the population. Though it is still challenging, because you find in the 84 islands that are on Kalangala, not in each and every home has a form of media, for example, radios or something, or that they'll get to know more information. But also, we have programs that are running at our health facilities for the youth. Like at Kalangala Health Center 4, we have a youth-friendly service that is running, whereby we expect to get youth from the community to come and at least learn something or consult anything that they would like, inclusive of the contraceptives or reproductive health and HIV, of course, because these two really move along. She also addressed the challenge of inaccessibility of healthy centers. As per now, as the district, we only have 15 government health facilities that are functional. It is still a challenge, as she said, that there are some islands whereby accessing a health center is really hard. However, in our health facilities that we have, we normally do what we call outreaches to reach to the down person, or the person who is really far deep in the village, to come for health attention or health care. However much those islands don't have health facilities, we really try to carry out those outreaches which are integrated. By integration, I mean most of the services are delivered through those outreaches. For example, ART services, maternal services, or reproductive health, which is more concerned to the youth. She also talked about the costs that are involved in accessibility of contraceptives. Trust me, most of the youth, I'm also a youth, by the way, but most of us have self-stigma. You know, at a certain point for a youth to go, let's say they want to access contraceptives, and this youth is about 15 years or 14 years. This is school going age. Of course, they'll feel inferior to go and ask for contraceptives or reproductive health services, because they feel like, oh, how will they see me asking for such? They'll think maybe I started, having sexual intercourse at a young age. However, through the parents and other people, us the health workers, we really have to educate the youth not to feel inferior when they want to access the contraceptives. Also, we really have to educate them on the steps to follow if one wants to start using contraceptives and how, where they are supposed to access them. But on the cost thing, like I said, there are some islands whereby there are no healthy facilities. Areas like Nkose, Kachungwa, there are some areas that are there way deep in the waters and they don't have health facilities. Of course, you will find a drug shop or a clinic, and this is going to lead to incurring costs for a youth to go and access contraceptives. For example, a youth has had sex and trying to protect them from getting pregnant, they will want to access short-term contraceptive to work on, stopping the pregnancy. Meaning, for that youth who is far deep in the islands, will just go to a clinic or a drug shop and buys the contraceptive. That is still a challenge, but it still takes us back to education. Let's educate these youths. Let them know their rights. Let them know what contraceptive is best for them. Let's try to advocate for sexual talk in these youths. Thank you.
Thank you so much. In your submission, I've heard that youths, there is kind of fear in youths to access contraceptives on a health facility, for fear of being known that maybe they're into sexual activities. Couldn't this fear be a reason of the environment at the health facility?
The fear is, I would say, both-sided. Yes, there is that fear of the community or the people that we live with or where we get health care from, but there is also self-fear, like self-stigma in this youth. However, apparently, as I told you, we have programs that are running at our facilities, the youth-friendly services or the youth-friendly corner, whereby we are all youths and the people who are working there are youths. It's very easier for a health provider that is in that clinic and the client who is a youth who wants contraceptives or who wants reproductive care. It is very easy for them to interact and get to know what to use, get to know how best to protect themselves from unwanted pregnancies. Thank you.
Thank you so much. Well, the Power to Youth program recently conducted a survey as part of their community scorecard, of which a lot of issues around adolescent health service provision came up from both schools and the community. So we are having an advocate here under Power to Youth, Dora Ziliwagwa. He's a youth advocate on this panel, and he was part of the survey. Now, Dora, could you share with us some of the findings and what do you think needs to be done to address the high rates of teenage pregnancies clearly? pointing out the roles of young people?
Thank you. According to the findings we got and the outcomes, like that, what should be done. One of them is, let us train more youth advocates. Most islands are lacking youth advocates to take back this information, to inform the youth or the adolescents about their services rendered at the health centers, to inform them what we have learned. Secondly, the health workers should be welcoming to these youth. We found a complaint that most health workers stigmatize these young children, these young adolescents. The adolescent may to go nga yetaka contraceptives, then the health worker is like, you the young child, why are you doing the family planning method? For what? At your age, why do you need it? Go back to school. So that stigma. Health workers should try to be welcoming to these young children, the adolescents. What should be done? More youth that should work in the youth corners. We found out that the youth corners are idle. At least 90%, they didn't have the youth corners. And no youth advocate to work or what help these youth when they have come to the health centers. The youth also asked the government they should employ some more youth health workers. They find it more comfortable for a young health worker or a teenage health worker working on them since they are the same age. Another outcome or what should be done, condom banks, because we found out that there are some places whereby condoms are not available in the communities. More condom banks should be applied in some in more villages, in the villages, especially those who don't have them. The other point is that the outreaches for our health workers to those villages which are far from the health centers, like Miana is far from the Center 3, Kachungwa, so it's very hard for them to go and find those services at the adolescents, transportation services, so of which the government should help the adolescents, or should help their health, should tell the in charges to increase the times they go for outreaches. Together, like in a month, they should go there twice to help these adolescents to access the contraceptives, to access the STI treatments. Secondly, we found out that health workers don't usually move with the STI treatments. These adolescents, and it should be just bought. Whereby into this STI, they have more STIs and they didn't know about the treatment. It should be free of charge. The government should also put up more initiatives, the skilling programs. We found out that most adolescents are not going to school. It will help us to decrease the teenage pregnancies. Skilling programs in some communities, they're not there. Like in Kalangala, we don't have any, of which it's for the government. Skilling programs will do more good to these adolescents, especially to the girls. Parents should also take their responsibilities, their roles as parents. They should not leave these children for the world, for the community. Let us go back and take our responsibilities as our mothers, as fathers. These are our children. Tomorrow they will be our general. They will be the parents of tomorrow. So we are trying to neglect them because of money. We are trying to neglect them. We are working overtime. Let us go back and take our responsibilities. The community leaders, let's take our roles. Let us go back and make the community dialogues. The community youth dialogues, like we call the youth, we intervene with them, we have discussion about the sex talks as in the old days. That's what our parents used to do. They could call us, we talk about sex talks, but right now they're not there. The other outcomes is about what should be done, training the senior teachers in schools, senior women and senior men. We have to train them, since they are people who already stay with our children, the adolescents. They know what to do, and we teach them what they should do about the sex talks. Because I remember in my primary, they could call us over the weekend. The senior woman teacher could talk to us as the adolescents, tells us how to clean ourselves, tells us about our menstrual periods, and makes us, they could give us awareness about the sex talks, since we were just adolescents. And lastly, the government should provide more services for the youth, the adolescent and sexual health services, because we found out that some services are not okay. They are scarce. There are no STI treatments. There are no the change in the condoms. I found that issue. They feel like they want to change these pink condoms. They no longer need them. They need some other types. Thank you.
Thank you so much. We are time bound, but our ADHO has a lot of issues to to answer. Well, ADHO, I know and understand that you do have really mechanisms in place to check service provision, service delivery of these contraceptives. You've had issue of environment at the health facility, the issues of absence, of some health workers at the facility, and much more. What's your take on all these issues in a way of having solutions for this?
Thank you very much. And I'm glad to hear that at least we can have a platform where we can stand and talk about adolescent health, their needs, and the challenges they face as young people. Because if the young are suffering, it means even they will be suffering as adults. So as I told you, I'm the ADHO, or assistant to the district health officer, and I take charge of the maternal child health services, including adolescents. Yeah, they are within my docket. So I've been listening carefully, and really what I've been hearing is not good, because the adolescents shouldn't fear, shouldn't shun away from our services. And in all service delivery, we should make sure that at least we work to the standards that will impress the youth, so that they grow up knowing they are important, and they should also take care of their lives. She has been talking about the difficult to access services. Moreover, the government had put a standard that a youth should have a peer to support that youth to have the capacity to know what to seek, what to ask, what to want. But if the environment is really hindering, it's not good. Here in Kalangala district, we don't have many youth corners, like they've said. Those facilities which don't have youth corners, they end up giving services, give adolescents and youth services together with adults. And those centers which have, still they are reported not to have adequate or good services or standard services. Yeah, the district is working hard to lobby for those partners, to lobby from partners of any kind, whether HIV partners or maternal child health or anybody who can at least come out to support the adolescents, youth, and younger people. She has mentioned about information sharing. We are trying hard to see that we give information. Let them be informed. Let them make choices on information. Because if you are informed, you will know what you ask for. And here in Kalangala, we work with the Heroes program, Heroes for gender-based, for gender transformative. They are targeting the youth. And all information given is information to support a youth, or adolescent, or a young person in school or out of school to be able to access services. But you'll find that with the time, they will phase out, and you have to look out for sustainability to make sure that even when they go, that's why we are choosing to have youth advocates. And these youth advocates, we want as many as we can, because as you've been listening, the youth and adolescent entrust their privacy to fellow youth, to fellow adolescents, to fellow peers. If we can have as many as possible, if they can choose to come and work with us in facilities, if they can choose to come and be with us, if they come to our reception and they receive the adolescents, if they can allow to work with us. But the challenge we don't have many motivational modalities to attract them or to keep them near us. So the attrition rate is somehow high, because it is also very difficult for a young person to stay in one place without getting any facilitation. Yeah, according to the task of explaining, because they say some of the things that hinder them, maybe the health workers are not there. Maybe they are absent. Yes, I personally am a medical supervisor and a technical person in issues of maternal child health, including family planning. So for someone to get adequate and standard family planning services, you must be a midwife, because a midwife is trained to handle or to know or to teach things about reproduction, all those things concerning childbearing, child prevention, all those issues, or being healthy as a reproductive person. They are trained to a midwife. But you find that those people, that cadre, they are the fewest in the district. Not because we are not recruiting, but the government policy says that at least a health center 2 should have one midwife, and a health center 3 should also have one midwife. Then a center 4 should have 2 midwives. Now, if you are only one midwife, it means you'll have to work at least 24 hours a day, 7 days a week, 30 days a month, and you'll be working 365 days in a year, because you are alone, which is not feasible. It is not possible. So you find that many times health workers just break up to rest or to have their time also, because they are also mothers, they are also wives, some are husbands, they have to take their children to school. And maybe in many cases the community has not understood them, because disease has not stopped whether you have your own issues. But this has to be also communicated so that the communities understand. And you find that even in Center 4, where there are only 2, if one is off duty, it means the other one will work throughout. So there is somehow a burnout on those midwives on what to do. But since we are advocating for youth peers and advocates, we want to train them, so that where we are not, they can handle some of those issues which don't need much technical practice, so that they support the health workers. So according to government, we are supposed to work 8 hours a day. Health workers are supposed to work 8 hours a day, and you are supposed, once you work 5 days, you're supposed to go off duty 2 days in a week. And in every year annually, a health worker is supposed to have a month according to stipulated days. There are those who rest 24 days, some rest 30, others 36, according to your salary scale. So you find that in a year you must have a month off, which means that facility with one midwife, they will experience a number of 30 days when the midwife is not on duty. So that's what usually causes them not to be around. Though I can't rule it out that some go away. Yeah, some may go away, but still, health workers go away for burial. Maybe they are going to attend someone's wedding, and it is very difficult to get a health worker who is away just like that for many, many days. It can be 2 days, 3 days, but anyway, for someone suffering, it's too much. Yes, but I think interventions must be put in place to see that recruitment takes place. Yeah.
Thank you so much. On the issue of time, we have a representative in the office of the RDC, or the representative of the president in the district. We know that this is an accountability office, and you make so many findings in the field. Basing on the findings of health provisions in our health facilities and in our communities, what are some of your findings, and what do you think are you going to set up to see, or what you're going to do to see that these gaps are filled?
Thank you. As I told you, my name is Kajubi, ARDC. On that question you're asking, I can say that I can give out some points why there is some gaps. I can start with schools are located far from the special learning sites. You may find some islands with no school or with one school. So as a government, we have already planned for that to relocate some schools in different areas, in that we can solve that problem. Girls are not controlled by the parents, especially in the learning sites. Some learning sites, you find girls moving freely anytime. During night, they are coming from clubs. They are coming from Bibanda, watching films. So they have a lot of time to be free. So as a office of RDC, of office of the president, I encourage parents to start monitoring those, especially girls. Another point is like some areas that is not working. The leaders, especially the chairperson, LC1s, they are doing their own things. They are not serious. So I'm encouraging the LC chairpersons to work on that issues. The parents get, I think I will advise some parents, especially to those girls I can call it child, mother child. Let us encourage them to go back to school. If you don't have money, as a government, through President Museveni, they set up some schools, vocational schools. Let those girls send it to those schools. Let us encourage them to go back. I think I had some problem of hospital. I don't know whether from there is no hospitals, they lack hospitals. As the office of the president, we have to assure Kalangala that as a government, there is a program of expanding health center for Kalangala to become an hospital, a referral hospital. So the moment we got a referral hospital, I think even some problems will be solved.
Thank you so much for this very interesting conversation. And I thank you all for the contributions that you have made and the submissions that you have made. I'm going to only have a few seconds, each and every one, at least to have a commitment, to make a commitment, starting from here, a health worker, as we go on, making a commitment, each and every one.
Okay. As the journalist in the Kalangala district, we will always have our cameras, and our work will always focus on changing the communities where we work from. Starting from these teenager pregnancies, how these teenagers can access adolescent services, through airing out where the gaps are, and working with these organizations like Power to Youth, will be able at least to bring out the issues that are embedded in the community, which are not really covered and are not known. We'll bring them to light, and the community will know it, organization will get to know them, and they will look for immediate solutions so that we can change these islands for better.
Thank you once again. As I wrap up today's session, I'll wrap up by addressing some of the challenges that also we as health workers go through in service delivery to the youth. However much we have some of the youth-friendly service corners that are functional, we still need more that are required to the facilities that really don't have to add on the service delivery. And also the other issue, as health workers, however much we do integrated outreaches, it is really very hard, because where you sometimes find it is, let's say, two health workers who have gone for outreaches and they are the only ones who are providing all the services, which is very overwhelming. We need more of motivation, at least, to help us in service delivery. Thank you. Our commitment, we shall still serve the community as we said we shall deliver. Yeah.
My commitment as the youth advocate, I'm going to go back to make my fellow youth aware that at the health centers there are services. Because even me, I didn't know that we had a special case at the health facilities. I'm going to inform them whatever I've learned to make sure that we have reduced the number of teenage pregnancies in our communities, especially the islands. Thank you.
As a leader and a supervisor, for me, I commit to work closely with the office of the RDC, because for them they are everywhere and they have the power to change. Also to work with the sub-county leadership to make sure we push the implementation of the new staffing structure, which will help us to have more health workers, to have continuous training about the sexual reproductive health among the youth. Also to encourage the youth to remain more in school instead of dropping out to become mothers. Let them stay more in school, and also to empower the girls in the signs and symptoms of SGVB. Yes, that's where I commit.
Thank you. As the office of RDC, I want to assure you that as an office, we are going to monitor, especially those cases. We will monitoring up to the end, and we see where the corruption. Second, I want to encourage the community about that reimburse poverty that our president, His Excellency Yoweri Kaguta Museveni, brought government programs like PDM, Emyoga. So I encourage the community to join, and we end that song of poverty. Thank you.
Well, thank you so much for listening to our Fireside Chat Podcast. I remain your host, David Sekayinga, a part youth advocate and a local journalist working with Daily Monitor and CBS FM Manduso. Till next time, we say bye-bye.